Hello and welcome to the Bristol Heart Institute at the University Hospitals Bristol and Western NHS Foundation Trust. You are watching this video in preparation for your TAVI procedure, also known as transcatheter aortic valve implantation. The following will guide you through diagnosis and investigations, as well as what to expect during your time here with the TAVI team. What is aortic stenosis? Aortic stenosis is a disease of the heart valve. The heart valves are like doors in the heart. They open and allow blood to move through one way, then close behind. The aortic valve is the last door in the heart, before blood enters the rest of the body. When someone has aortic stenosis, this valve slowly narrows with calcium buildup, which can have an adverse effect on the body's flow of oxygenated blood. As a result, patients can experience a variety of symptoms, the most common being breathlessness. For example, you may notice that you're getting more out of puff when you go for walks, or when you participate in day-to-day activities such as gardening or vacuuming. This breathlessness can get worse over time. With more advanced aortic stenosis, you can start to develop chest pain, dizziness, or even blackout. Diagnosis. Aortic stenosis can often be heard if a clinician listens to your chest with a stethoscope. Initial diagnosis of aortic stenosis is through an echocardiogram. An echo is an ultrasound of the heart. It's performed by doing a jelly scanner in your chest, which uses sound waves to assess the opening of the aortic valve. This will often be performed at your local hospital. Following the echo, if your clinician feels that your aortic valve needs treating, then they may refer you for additional investigations. Investigations. CT scans are necessary prior to performing a TAVI. The scan will look in detail at your aortic root and help to select an appropriate valve type and size specific to you. It also helps the TAVI team to determine the access suitability for you, whether this is for your groin or whether we need to access an alternative route. The scan may be performed at your local hospital or here at the Bristol Heart Institute. Once all investigations have been completed, your case will be reviewed in a multidisciplinary meeting, which gives the TAVI team the opportunity to review all your investigations. What is TAVI? TAVI can be performed by many different access routes, but the most common route is by an artery in your leg. We use local anaesthetic to numb the area and then make a very small incision in your groin. Then we pass the sheath through your artery and up into your heart. The new valve is inflated into your old valve, pushing it open. The normal opening of the valve is then restored. Generally speaking, TAVI is a safe procedure, but major complications can occur, and the consultant will discuss any potential risks during your consultation. It is important to remember, however, that the risk of not treating the valve is much higher, and severe aortic stenosis, if left untreated, is life-limiting. Day of procedure. You will be admitted to the hospital either the night before or the morning of your procedure. You should not have any food or drink other than water in the 6 hours leading up to your procedure. The nurses will let you know whether there are any medications that you need to stop taking beforehand. Once you're in the day case unit, the nurses will help you into a gown and may insert a small cannula into your arm. The TAVI doctor will then come to discuss the case and go through the consent with you. In the catheter labs, there will be a number of staff to support you, and the procedure generally takes 45 minutes to an hour and a half. Going home. Following your TAVI procedure, you will be taken to the recovery unit. You will be asked to stay lying flat for a period of time. After 4 to 6 hours, the team may help to mobilise you around the bed area. Hopefully, by the end of the day, you will be sitting up in bed, eating and drinking. However, on some occasions, you may need more rest. Generally, the quicker you get up and out of bed, the quicker you can go home. The following day, we will undertake an echocardiogram to assess the TAVI and your heart function. You will also be kept on a cardiac monitor to assess your heart rate and rhythm. A nurse will check your wound before you go home and explain any aftercare. You may feel tired when you first go home. For a minimum of 2 weeks, we advise you to take things easy, but you should still be able to do your day-to-day activities. For example, we'd recommend going for a short walk, gradually building this up. Please avoid undertaking activities such as carrying heavy shopping vacuuming, or gardening. The DVLA advises that you do not drive while you have untreated symptomatic severe aortic stenosis. However, following your TAVI, you may then drive up to 4 weeks following the procedure, as long as there are no other reasons prohibiting you. It is also important to maintain excellent oral health after your TAVI procedure. Poor dental hygiene can increase the risk of a bacterial infection in the bloodstream, which can lead to an infection of the heart called endocarditis. Therefore, it is very important that you are registered with a local dentist. Once you are home, the TAVI team will arrange a follow-up appointment in around 6 to 8 weeks, either on the telephone or in our clinic. Thank you for taking the time to watch this today. If you have any questions following this video, please ask one of the TAVI team. We are here to support you throughout your TAVI journey.